this concept of disordered eating, which can be a variable experience for folks where there's some dysfunction in terms of the healthiness of their relationship with their bodies and with food. Our goal is really to provide like holistic assessment for people that are coming in with a concern of disordered eating patterns.
I have anorexia nervosa BP subtype, and after I went to residential, I came back here to the EDTC, and Dr. Sowar became my psychiatrist.
The historical stigma that, young white females were the most commonly impacted group is not true. That it definitely impacts people of all ages, genders, and also people of all races and ethnic backgrounds. We think about how to support their nutritional growth, their therapeutic kind of healing and understanding about some of the roots of the eating disorder. But also there's a lot to be said about our communities and the social connections and kind of ways that we can reinforce, how people feed themselves and nourish themselves and kind of how they appreciate their bodies in ways that hopefully are more gracious and may not be quite as triggering of some of the eating disorder.
The medication does play a large factor into that regarding your disorder or whatever you're going through, and like a good psychiatrist like Dr. Sowar can make all the difference in that. Like, find someone that works for you.
Eating disorders for most people is that it is a mix of genetic predisposition and then some environmental trigger that may be a combination of social and cultural pressures along with something specific for an individual. Many people with eating disorders, kind of the way that the reward pathways and kind of the way that our body and our brain helps regulate like our drive to eat or our reward from eating or our inhibition of eating, that there are things that become dysregulated there.
There's just not enough places for people who need help. I would say that goes for mental health and any conditions that follow like that. Like, we need more programs that can help people.
If you feel like someone you're connected to, someone you love or care about is struggling with an eating disorder, support them. The first time that question comes up, it may not be something people are open to, but it can be at least kind of a pathway into the door of seeing their challenges as something that is deserving of and can need help.